my friends. This is Dr. Diana as patient, and I am pretty ill. Can we talk mast cells? Since the new protocol is out and posted on my website at prettyill.com, you can find it under the handout section if you'd like to go straight to it. I wanted to share with you the basics of the new protocol for diagnosis. This is a huge change, and I humbly think that it will continue to be tweaked, but I received so many questions about this. I thought I'd cover the basics with you together, okay? Now let's keep it simple. Think in terms of three major types, okay? One, cutaneous mastocytosis, such as hives, urticaria pigmentosa, eczema, okay? Two, systemic mastocytosis. This means the mast cells are not just in the skin. Very commonly, we can find them in the bone marrow. It can be indolent, smoldering, or aggressive. Now we see with aggressive the liver involvement, malabsorption, cytopenias, which is a lower than normal number of blood cells. In fact, in our family, we deal with anemia, which is one of the cytopenias, for example. Now, in the very rare case, we'll find mast cell leukemia. Fortunately, that remains very rare. Number three, mast cell activation syndrome, MCAS. Yep, we no longer call it Mcas, mast cell activation disorder. So these patients have the typical symptoms of mast cell disease and a good response to mast cell anti-mediator medication. This is why some people may even serendipitously end up self-treating. They may take an antihistamine for some reason and voila, they feel better. That happened to me with Zyrtec 7 years ago. I had no idea why it was helping me back then, but it was a huge help. I was desperate to have it every day. In fact, by the time patients usually figure out that they may have mast cell disorders, yes, I said patients because doctors commonly miss this because they don't live with us 24/7, okay? The patients usually self-medicating with H1 and H2 antagonists without even realizing why. They just know it helps them feel better. It's helped their GERD, for example, or their stomach acid production, which tends to be too high. Now, this is where it gets interesting. You can have MCAS mediator plus. This means you have symptoms, you respond to medication, and you have a positive result on any of these. Your serum tryptase test, urine methylhistamine test, prostaglandins D2, or you have elevated IgE or a positive RAST. Or you can have MCAS mediator negative. This means you have symptoms, you respond to medication, and you have negative results on your serum and urine tests. So for MCAS negative folks, mediator negative folks, if you have the symptoms, you respond to medication, but your testing is negative, you still treat it exactly the same as if the testing was positive, okay? Now, I had a consult with a mast cell specialist not too long ago, and I still need to check my prostaglandin C2 and my IgE, but my tryptase and methylhistamine were both normal. I respond beautifully to H1 and H2 antagonists. In my household, I use double dose Zantac and Zyrtec. My GI doctor added gastrocrom or sodium cromolyn, and I'm adding ketotifen in the evening just to see if that helps. But the specialist said I was doing all the right stuff. So unless my blood or urine test came back positive, I didn't need to see the mast cell specialist or have a bone marrow biopsy. Woohoo! Ditto with my kids. Cool. So I believe that these classifications will probably change. However, I did have mast cell involvement in my brain, in my heart, and now looks like my appendix. Yikes. So my friends, we may end up with our own little corner of the mast cell world. We may have our own classification soon. I'm just getting this feeling. Some organ involvement, some skin signs, POTS. You had a great response to medication. Many of us have negative blood work in urinalysis. There just doesn't seem to be a spot for us with that kind of conglomeration. So we're special. But we're used to being special, right? So, my friends, I will continue to watch for changes to the protocol and will report back to you. Watch for more handouts, podcasts, and in time, webinars to disseminate as much information about this and many of our other issues to as many people as possible, as quickly as possible. So handouts are great. But I love videos, as you know, especially for those of us who are just too sick to read. I have been there. Many of you know, for the first 3 years of my illness, I had my bed, my couch, and Oprah. Now, I've been down that road, and although I'm still symptomatic, I am able to actually get vertical now and again. So I like to shorten your journey, make things easier for you than they were for me. That's why I'm here. So let's continue to change our world, one brain cell at a time if we have to. Gentle hugs to you all.